Hello everyone. So today we are going to discuss the gross anatomy of cecum. So as most of the students think, cecum is just a blind sac from which the large intestine begins. But deep inside this region, there are some folds present that will lead the surgeons during appendectomy procedure to find the appendix. So seeing this, let's begin the class of today on the gross anatomy of cecum. So what is cecum? It is a blind sac from which the large intestine begins. So it is of 6 centimeter length and 7.5 centimeter width. So seeing this parameter, we can say the width of the cecum is more than the length. Some other organs in which the width is more than the length are the prostate gland, the isthmus of the thyroid gland, and the pituitary gland. Now we'll see where does the cecum located. So for that I am making the pelvis girdle. This now I am drawing the sacrum which will articulate with lumbar vertebra, now this is the iliac crest, this is pubic symphysis. So now we are going to draw the transtubercular plane, which this is the transtubercular plane which lies at the lower border of L5 vertebra. So a horizontal line at the lower border of L5 vertebra, the transtubercular plane we have made. Now we are going to make one ligament that is passing from anterior superior iliac spine till the pubic tubercle. So what ligament is this? This is what? The inguinal ligament. So what is this? This is inguinal ligament. And one from the right mid clavicular point will make a line vertically. So this is right mid clavicular line, or you can say right lateral line. So this triangular area between the transtubercular plane, lateral half of the inguinal ligament, and the right mid clavicular line, this triangular area is where the cecum is located. So in this area the cecum is located. So what is this area called as? Right iliac fossa. So in the right, so location of the cecum. So location, it is present in the right iliac fossa. And what is the triangular boundary? Superiorly transtubercular plane, inferiorly by the lateral half of inguinal ligament, and medially by the right mid clavicular line. So these are the boundaries in which the cecum is presented. Now, what are the communication of the cecum? So this blind sac is what cecum is. So cecum is communicated medially through what? Ileum. So this junction is what? Ileocecal junction. And it is communicating above with what? Ascending colon. It is communicated on the posteromedial wall. What is this? On the posterior medial wall, it is communicating with appendix. So it is communicating medially by ileum, superiorly by the ascending colon, posteromedially by appendix. Now we'll see the development. How does the cecum develop? The cecum is a endodermal derivative and it derived from the gut tube. So if I am making the gut tube, so this part is foregut, this part is midgut, and this part is hindgut. And from behind, this is dorsal aorta and each part. So foregut is supplied by the celiac trunk, midgut is supplied by the superior mesenteric artery, and the hindgut is supplied by the inferior mesenteric artery. And this loop like structure that is coming out, this loop is what? The midgut loop that will come out as a physiological hernia along the axis of superior mesenteric artery. So along the axis of superior mesenteric artery, this above loop is called as pre-arterial limb and this lower one is called as post-arterial limb, or you can say pre-arterial or cephalic, post-arterial or caudal limb. Along this post-arterial limb, one bud or the diverticular develop, that is what? Cecal bud. So this is what? Cecal bud. Now this cecal bud, so if this is the cecal bud and if this is the proximal part and this is the distal part, the proximal part of the cecal bud dilates in this way and the distal part will remain same. So this proximal part will form the cecum and the distal part which will be attached to the apex, that will form the appendix at, or you can say before birth. Then after birth, what happens? This cecum will have two sacculation, right and left saccules are formed, and in the concavity of this two saccule the appendix will be present. So this is at before birth, after birth, but it is still growing. So after that, when it is fully grown, the right saccule will grow more than the left saccule, and this is the ileocecal junction, and this is where the appendix is present. So this is the matured, or you can say fully grown cecum. So this is the right saccule, this is the left saccule, and this is the base of the appendix, and this base of the appendix is, and this is ileocecal junction. So base of the appendix and the ileocecal junction is at a distance of 2 to 3 centimeter from each other. So this is what the adult cecum formation occurs. Now, seeing this, we'll classify the cecum into several types. So what are the types of cecum? So types of cecum. So already we have, so in that we'll see firstly the normal type, which is present in 80 to 90% population. So what is the normal type? So the right saccule will be more than the left saccule, and this is the base of the appendix and the ileocecal junction, and the distance between the base of the appendix and the ileocecal junction should be 2 to 3 centimeters. So this is the normal type. Then one more is there, exaggerated type. So what would be the exaggerated type? The right saccule will develop extremely and the left saccule will not develop, and it will regress such that the cecum, the ileocecal junction and the appendix, there will be no distance between each other. So it will be lying in a close approximity, the appendix and the ileocecal junction. So extended right saccule and no left saccule. So this is what exaggerated type of cecum. Then third type is what? Infantile type, or you can say quadrate type. It is seen in 2 to 3% population. This is what this one where there are equally divided right and left saccule, and in the concavity the base of the appendix is present. So this is called as infantile, or you can say quadrate type. Then the finally the last one, this is what? Fetal type, or you can say conical type. How will it will be? Like the cone base, and at the tip there will be appendix attached. So this is what fetal type. It is seen in 1 to 2% population. So in this way we can say normal type seen in 80 to 90% population, exaggerated type it is seen in 4 to 5% population, then infantile type in 2 to 3%, and fetal type 1 to 2% of the population. So this was about the type, and we have seen the development and the type of the appendix. Now we'll see the visceral relation of the cecum. So visceral relation. So in this we will see what structures come in relation anteriorly and what structures comes in relation posteriorly. So anteriorly, so if there the cecum is lying anteriorly, so if this is the ileocecal junction, so the loops of small intestine will be lying anteriorly, and it will be covered by greater omentum. So greater omentum and loops of small intestine, and above this all what will be there? Anterior abdominal wall. So this all structures will form the anterior relation to the cecum. So what structure? The coils of large intestine, coils of small intestine, greater omentum and anterior abdominal wall. This will form the anterior relation. Then the visceral relation will be, so we'll draw here only the visceral relation. So for that We'll remove this cecum firstly. So one muscle that is attached along the borders of the lumbar vertebra of L1 to L5. So this is psoas muscle, and on the iliac fossa, iliacus muscle. So iliacus and the psoas will form ileocecal tendon. Then one nerve, femoral nerve, lateral cutaneous nerve of thigh. Then in at the level of L4, the abdominal aorta will divide into common iliac, and this common iliac will also divide into internal iliac and external iliac. And one more nerve, genitofemoral nerve. So, and here somewhere in this part, the cecum is located. So what structures comes in relation with the cecum? Two muscles, psoas major and iliacus. Two nerves, lateral cutaneous nerve of thigh and femoral nerve, and two vessels, gonadal vessel and external iliac vessel. So what structures come in relation to the cecum? Posteriorly, psoas major and iliacus, lateral cutaneous nerve of thigh and femoral nerve, gonadal vessel and external iliac vessel. So this all structures comes in relation to the cecum posteriorly. Now, as we have discussed the visceral relation, now we'll see the peritoneum will have some folds that are attaching to the cecum. So the peritoneal folds. Three peritoneal folds. Superior ileocecal fold, inferior ileocecal fold, and you can say cecal fold or posterior cecal fold. So for that we'll draw here only. If this is the cecum, and this is the ileocecal junction, and this is the appendix, and here the ascending colon. Now one fold of the peritoneum that is attaching the terminal ileum through the ascending colon, this is called as superior ileocecal fold. And from the terminal ileum to the base of the appendix, one more fold will be present. So this is what? Inferior ileocecal fold. Then behind this cecum, behind the cecum, some fold will be present that is called as posterior cecal fold. So along, what is the importance of this cecal fold is, along this superior ileocecal fold, so here where the ileocolic artery will be present. So this ileocolic artery will give one artery, that is anterior cecal artery. This anterior cecal artery runs along this superior ileocecal fold. So that's why this superior ileocecal fold is a vascular fold. And the inferior ileocecal fold will have no such artery. So that's why it is also called as bloodless fold of Travis. So this is what the surgical importance. So during the surgery of appendectomy, the surgeon will find this bloodless fold of Travis to go towards the base of the appendix and to avoid injury to any arterial structure, to avoid bleeding complication during the surgery. Now we have seen all the three folds. Now in this fold, in the superior ileocecal fold, there will be superior ileocecal recess will be present, and in the inferior ileocecal fold, inferior ileocecal recess will be present. And along the border of the cecal fold, posterior cecal fold, there will be one more recess that will be present behind the cecum, that is called as retrocecal recess. Okay, so in this way there are three folds and three recesses. Now, what is the arterial supply, blood supply, and the nerve supply? The arterial supply, as we have already seen, the ileocolic artery, which is a branch of superior mesenteric artery, and venous supply will be, venous drainage will be same ileocecal vein, which will drain into superior mesenteric vein, which will finally drain into portal vein. Then the nerve supply. Nerve supply, it has two components, parasympathetic and sympathetic. As we know, the parasympathetic component will be what? Till the midgut, the whole parasympathetic component will be by the vagus nerve. The sympathetic component will be the superior mesenteric plexus, which will have the ganglionic fibers from T10 to L1 segment of the spinal cord. As we have seen, the how the cecal bud has formed, and it is lead to the formation of this cecum. So during this folding of the midgut, the cecum can present, like if the rotation, there is faulty rotation, so cecum can lie in some abnormal position. So what are these abnormal positions where the cecum can lie? It can lie in the subhepatic region, it can lie in the left subhepatic region. Okay. So now we'll see the applied part. So what will be the applied part? Undescended cecum. So what is this undescended cecum? During the development, if the cecum is lying in the right subhepatic region and it is not descending below into the right iliac fossa, so that is called as undescended cecum. Due to it occurs due to faulty or misrotation of the midgut. Then one more term you should know in the applied anatomy part, that is what? Intersusception. Intersusception. So what is this intersusception? So if this is the intestine, so this is the proximal segment and this is the distal segment. If the proximal segment gets invaginate into the distal segment, the proximal segment of the small intestine is invaginating into the distal segment of the large intestine. This can occur in the ileocecal junction. So that is what intersusception mean, and this can lead to what? Obstruction of the bowel. So this is a applied part that you should know in the cecum. What? The undescended cecum and the intersusception. So thank you for watching my video. Please like, share and subscribe my channel. Thank you.